Hello, everyone. I'm Dr. Renee Mehrra, and May is Mental Health Awareness Month. And this year's theme is Tools to Thrive, Increase Our Resiliency. And today, with my guest, I'm going to be creating this conversation: how do we manage mental health disorders through holistic treatment, through Ayurveda, through nutritional supplements, through counseling. And this can also help to reduce the stigma surrounding mental health illnesses as well as substance use. So talking to me, I have Dr. Sujatha Reddy, and she is an Ayurvedic physician practicing for almost 30 years in the United States. And she is has a master's in community counseling from University of Dayton in Ohio, and she's licensed both in Colorado and Ohio for community counseling. And Dr. Sujatha Reddy is a health, wellness, and meditation coach. She's certified in yoga, pranayama, and offers nutritional treatments for mental disorders, as well as offers cognitive behavioral therapy. She has a Be Well, Mind, Body, Spirit, which is a full-service counseling center in Lakewood, Colorado. And that focuses on adult mental health counseling, health and wellness, coaching, and Ayurvedic consultation. So thank you very much, Dr. Sujatha Reddy. And let's talk to you about, we're going through some very challenging times, with the pandemic, and that only actually exacerbates the situation if somebody has anxiety and depression. And so how do we cope with this, challenging time? How do we manage the mind?
First of all, Renee, thank you for giving me this opportunity to interview with you. And as a Ayurvedic doctor and a mental health counselor, we are all, I want to address today exactly what you want to interview me for. How do we manage this, right? So this pandemic, with our generation, we really have not seen it. And what is this? This is an environmental threat to our existence. When we think about how free we were and how without any restrictions, we could go out and walk in public and get together in the gatherings and, socialize and, really thrive in that environment. And that was our norm. And now when we are hit with COVID, what just happened, right? Everything was taken away from us. Now, let us talk a little bit about what really happens in our body, when we feel a threat, okay? So those days during caveman times, when people would go to hunt, then if they were attacked by a saber, then either they would run away or they would fight. And if they couldn't do both, then they would freeze. It is nothing different, So these days, it doesn't have to be a saber, It can be any threat from the outside that our mind perceives as a threat to our own existence. So if our own freedom is taken away, of how as men, as human beings, we are social animals. And we thrive on connection. Connection to, our family, to our friends, to the outside world, we thrive on that. And when that itself is pulled out and we are restricted, it is perceived as a threat. When that happens, we start operating out of fear. And our amygdala, the lower part of our brain, is perceiving that as a threat. And we go into the whole fight, flight, or freeze response. There is a certain, cadence that we are all born with that, we can, tolerate this for some time. Some people can tolerate it for longer than some others. We are all born with a predisposition to tolerate this. You can call this as immunity, mental immunity. And when we cannot do this anymore, then we start experiencing a lot of stress. The stress is more physiological, then it builds up to psychological stress. In Ayurveda, the imbalance is manifested two ways. One is through the physical body. It is manifested as a disease, and then it affects us psychologically. And the other way is when there is emotional stress, psychological stress, it also affects us, in the physical body. So this is how we start experiencing, emotional, mental imbalance, as well as affects our physical body too. So that's how we start developing anxiety. What is anxiety? Anxiety is nothing but the fear of the future, and depression is nothing but it is from the past, So when we start projecting our past to the present, then we are grieving, we are sad of whatever we have not had, or losses we have faced in our life. So that is what we are bringing to the present in our life as depression. But with anxiety, the fear of the future is very apparent, especially with this pandemic times. We start experiencing nervousness, we cannot breathe properly, and our mind is racing, we cannot sleep properly, we cannot eat properly, and we start having panic attacks, and we start, the stress sort of builds up in our body.
I like the way you put out, how depression, anxiety, and anxiety for the future, and depression from the past, and and everything gets in creating an imbalance. And you did mention, about the environment, and you see that how COVID has affected, pretty much everyone, And so it's multiple challenges. We're looking at the environment, we're looking at the inner state that you talked about, we're looking at genetics, and at the same time, we're also looking at culture. There are many cultures, especially in South Asian communities, we don't talk about it. We think it's a taboo to talk about anything with mental illness. And so we go into denial, and then it gets, the condition gets even worse and worse. And by the time we seek help, it gets to be sometimes very late. So again, in any imbalance in any disease or any treatment, early intervention is the key to reduce those symptoms and for better health. So how do we look at these challenges, especially from the holistic perspective, from Ayurveda perspective? And since you combine a lot of treatments, you integrate them, whether it's nutrition or whether it's Ayurveda, whether it's emotional freedom technique, cognitive behavioral therapy, when you're looking at all these multiple challenges, it is a challenge then to treat patients.
Yeah, so there's a lot of things you mentioned in there. So first of all, you talked about culture. Yes, culture specifically, is very unique to different, cultures, right? So, and different countries. When we are looking at the specific South Asian culture, people are not directly talking to somebody about, whether they're having depression or anxiety. Their tendency is to go to their religious heads, or religious priests, and then go to temples. So these are the very passive ways that they're addressing, their mental health issues. Something is not going right in the family, or somebody is not doing well in the family, they will consult their family priest and say, okay, what kind of pujas or rituals can we do, so that we can alleviate this problem. And, so a lot of these are very common in the South Asian population. And for women especially, they really don't express, don't know how to express as much. So the way they express mental health is through their body. They start talking about pains everywhere in their body. We call it as fibromyalgia, and so that's the diagnosis they get. They go to the doctor, they ask, they complain about, this hurts, that hurts, my whole body hurts, I'm not able to sleep. So there is a deeper issue. It's not, if the doctor is not able to specifically point to one diagnosis, then, it is termed as fibromyalgia, and it always leads to a mental health issue. And so that's how, we have to understand cultures, and that's how we have to approach, different cultures and how they're presenting, mental health. And another thing is you mentioned is that how do we manage all this, right? Depending on who comes to you as a mental health counselor. If somebody's, is coming to me, say for anxiety, or depression, what do I do? Depending on where they come from, if they're not ready to talk about it, it's okay, so I address it from the physiological perspective, from their body, the pain, the emotional freedom techniques really helps with that. So we start, in Ayurveda, the emotional freedom technique is nothing but the marma points, the points in the body is what we target, where, we start to, actually stimulate the nerve endings to release some of that stress, to release some of the anxiety and the depression, so they can actually come out of that state of fear and anxiety and into the prefrontal cortex, where they can think cognitively and become more aware of their issue. And then they slowly ease up, and you can make the patient feels so comfortable that they will open up and talk to you. And yes, of course, what do we have in Ayurveda, to even address all of those things? There's definitely plenty of it, and I can go into that, when we are ready.
And when we're looking at these challenging times, the isolation, itself makes it, it just compounds the issue, because a person in a depressed state, or has a lot of anxiety, high anxiety, they tend to sometimes isolate themselves, and we are living in this right now, a culture of isolation and social distancing. And very often when we move away from our family or loved ones in this state, it only actually makes things even worse. So I guess when you're looking at the symptoms, you have to look at, if they are really talking to their friends, or they have completely isolated themselves. They don't have to meet them, but they can always have like a Zoom meeting or talk to them over the phone, so that they're able to connect and not get deeper and deeper into anxiety and depression.
Absolutely. So that is very important to identify what other support systems they have. What they used to have is one thing, but what do they have now? Technology is so advanced that we are all on the internet today. I wouldn't have been here without that, correct? So that's how people are meeting on the, video platforms. And even professionals are meeting it, people are having access to professionals through the internet, through these platforms. And it is definitely helpful and definitely better than, not having anything, right? And also looking at your support system, your own family, who you are living with, and how you can support each other, and how you can nurture your relationship with each other and try to find that true happiness. Sometimes we also have to, this also is a test for us. It's like fasting from your external environment, So once we also look at what is it that kept us going, like always trying to seek happiness through the outside world, and now it is not there. How can we seek the same happiness and going inwards, for that inner journey to find that happiness, to listen to spiritual talks, to listen to motivational talks, to listen to positive affirmations, to write a gratitude journal. Journaling is, so helpful and so healing. And so just by giving gratitude to what we have today and our health and our family, and protecting ourselves, looking at this environment and the pandemic as, well, this is what is required for now. We need to protect ourselves so that we can be healthy, and we need to support whatever the CDC or any of the recommendations, is there for the countries and the world today to help us live a healthy and balanced life.
And there's a lot of scientific research going on mitochondria, which are energy generators of cells. And they talk about if their function kind of changes, or there's a dysfunction in mitochondria, it can actually, it has a kind of a correlation with stress and anxiety. What is your take on this?
Yeah, I'm glad you brought that up. So everything relates back to, how, right? So we are talking about mitochondria here. So first of all, what is mitochondria? So mitochondria is an organelle in a cell. We are all only built up of cells, and our cell has its own system, and it has what is called as the mitochondria. It has the mitochondria itself has its own genome, and it produces, it is the powerhouse, and it stores energy. It converts oxygen into energy, and it stores it there for us to releases the energy, to be used later on. Now, what happens is also it releases energy in the form of also cortisols. We have to understand mitochondria produces cortisols, and it is released into the bloodstream to go into our muscles and our brain and all of these to help us, to help us live and be active. So cortisol is a hormone. Cortisol itself is like the sun, and the melatonin is the opposite. It is like the moon. Okay, so the highest cortisol levels that we have is early in the morning. Energy is high, and that is required, and so that we can function actively and throughout the day. And as the day goes down, the cortisol levels go down, but then we have the melatonin going up, so that we can go into a phase of rest. So there's a phase of being active, and then there's a phase of going into rest. So that's how the mitochondria functions. Now, when we are going through stress, say, for example, with this whole pandemic, what happens, right? So the mitochondria starts putting out, a lot of cortisols into the blood. When it bombards cortisols in the blood, it is sending it to the brain, to actually help us with the stress levels. Now the brain gets so overloaded with cortisols, it just goes into saying, I have had enough. I'm going to shut this down. And it is shutting down the mitochondria. Okay, when it shuts down the mitochondria, what happens? Now it is not able to be effective. It is not able to produce enough cortisols. So, it goes into a, shutdown mode. It has a low ability to make cortisol in the mitochondria, or it gets damaged, and so when it gets damaged, it dies, so then what happens? We are now reducing the number of mitochondria we have in our body. On an average, from the age of 25 to 40 years, there's 40% of our mitochondria is lost, and after that, by the age of 60, another 25% is lost. So once we lose the mitochondria, then how do we get it back? What is lost is lost. So how do we now have new mitochondria, right? The only way to do that is fasting. And you and I know very well in Ayurveda how much fasting is emphasized. It is built into our culture. It is built into our traditions. And a lot of the other religious, communities, religions have fasting as a protocol, and why is that? That is, when we go into fasting, we are going into a state where you produce more mitochondria. And that when you produce more mitochondria, then you're back, then you feel after fasting, when you start to, go into regular eating habits, you have more energy. And so that's how you rebuild your mitochondria. There is no medicine otherwise to actually manage your stress. Once your mitochondria is destroyed, it is destroyed. You just have to make new mitochondria. Now, having said that, when we have, what do we do with the existing mitochondria so we don't lose it, right? That's what we also want to focus on. How do we manage stress? We have, again, Ayurveda, everything is so well organized. We look at our body in not just a physical body, in like 5 panchakoshas. So let us start with what are the 5 panchakoshas? There is the Annamaya kosha, that is our physical body. There is the Pranamaya kosha, that is our breath and the vital functions in our body. There is the Manomaya kosha, which is our emotional mind and mind and emotions. Then there's a Vijnanamaya kosha, which is our discrimination, power of discrimination. Then there is the Anandamaya kosha, which is the bliss sheath. Okay, so every day, if we focused on all of these sheaths and take care of each sheath, then we will be able to enhance the production of, energy in our body. let us start with the physical body, right? In Ayurveda, we have the whole panchakarma system, like the body massage, the relaxation techniques, and the herbs that we need to take, and every day what we need to do, the exercise, the pranayama, the yoga, the meditation. These are all the things that when we adopt, that
That's
we
the
maintain.
protocol for self-care, we would say.
Yeah, we regulate the mitochondria, we regulate our nervous system, which is we are not always in a hyper aroused sympathetic state. We activate our parasympathetic state, we regulate our heart and our breathing, so that really keeps the cortisol levels down. And so the built-in amount of the quota we have of energy, through our genes is also maintained. We don't like run out, or we don't have, have to destroy our mitochondria because of that. Now, one of the things, there is, apart from the exercise, oxygen, oxygen is the one that is mitochondria loves, and not putting, another thing what mitochondria allows is non-chemical, all organic foods, and not, again, hair coloring or nail polishes or, chemicals that we put on our body, like perfumes. Mitochondria does not like that, so we have to, consume natural foods, use natural products, that is very important. Nature, getting out in the nature, mitochondria loves nature, so that helps build our energy. And then cold water, washing, if you remember, like coming outside into the house, you do not enter the house, without washing your hands and feet and your face, in cold water. What that does, it helps mitochondria. Not only that, it switches us from the hyperarousal state, from our sympathetic state to the parasympathetic state. That helps, regulate our nervous system. That again, in turn, helps the mitochondria, produce.
So not warm water, but cold water. You're talking.
Cold water. Yes, cold water.
Even in the winter time.
Huh?
In the
Sorry?
winter time too.
Yeah, washing your face. Yes. So there's another, like sunlight, very good for us. That helps our mitochondria. And then there is a red light, infrared light, that penetrates deeper into our tissues. That really helps regenerate mitochondria. So, and there is, in Ayurveda, we have what is called as dinacharya, daily routine, ratricharya, nightly routine, and we have ritucharya, seasonal routine. We have to be in sync with, the biorhythm of the nature. Okay. And not only that, I talked about fasting. We also have the Ayurvedic cleanse that we do in the spring and in the fall. And in between seasons, the transitional seasons where our body has to adjust and it goes into this little bit of a stress, in Ayurveda, everything is to maintain homeostasis, whether it is temperature from the outside, our body temperature is at 97. So we need to maintain that temperature. So we end up adjusting to the cold or the warm weather, the way we dress, right? Same thing, whether it is seasons, or same thing, whether it is food, what type of foods we need to eat. So all of this, we are only living and we are just balancing to be in the state of balance with the environment, every step of the way, whether it is in our body or our mind.
What about nutritional supplements?
Yeah, another thing is, Ayurvedic supplement wise. So one thing that happens with stress, and with this high cortisol levels is it causes inflammation in our body. So the inflammation, no matter how much you exercise, you will not be losing your weight because your body, you're high stressed, you're again putting your body through stress. So the inflammation, is there, so you're not going to lose. So then concentrating on how to keep your body, in an uninflamed state, one of the things again is rest and relax, right? That is very important. You don't have to always, get on the spinning, and do all these very aggressively. But there's one important thing you can do is resistance training, like building muscle, really helps. and you don't have to put your body through too much stress, and so that helps build your mental health and physical health. Another thing, taking supplements like shilajit or turmeric, these are very important to reduce inflammation. So shilajit itself, has it transforms maximum oxygen to the mitochondria, so that there is, through the blood circulation, so that there is this storage of energy, in the mitochondria. It really helps that. And we're looking also at turmeric and like ashwagandha. These are some of the herbal supplements that you can take for like adrenal fatigue, where you really need to, keep your adrenals healthy, so that your, mitochondria is healthy, and so you're not bombarded with, cortisol levels when you're stressed too much. And turmeric, anti-inflammatory. So much of research has been done. So that is also an important thing that, as coming from India, we use turmeric in everything, So that's why there is research saying that Alzheimer's, disease is much lesser in India compared to the Western world. I'm talking about vitamins. Some of the vitamins that really helps with, keeping our mitochondria healthy is CoQ10, a B12, vitamin D3, magnesium, and copper. Remember, we are told to drink water from a copper cup. Why? For the same reason. Especially when we age, our mitochondria is lesser, so we need to do more and more of this to maintain our health and our hormonal health. If we are having less mitochondria and we are too much stressed all the time, then it affects our thyroid, it affects our liver, it affects our ovaries, it affects our pancreas, it affects our gut. So we have to be very mindful about all of this.
So there's the nutritional supplements, there's Ayurvedic herbs, there's counseling, there's a whole lot of emotional freedom technique, the Marmot points you talked about, and then being in sync with nature is so very important in the biorhythms and our circadian rhythms. Everything has to be aligned. Back to nature, we've always been talking about in all of our shows. Back to nature is so very important. Back to our roots, that's very important too. And again, this is the Mental Health Awareness Month and Tools to Thrive to promote our resiliency. Thank you so much, Dr. Sujatha Reddy, for sharing so much of your valuable insights and making that treatment so holistic, and because we're all organic whole, and covering it from angles that really bring so much of health and wellness back. That's what your center is all about, be well, mind, body, and spirit. So if somebody wants to reach out to you, would you like to share your email?
Yes, actually, my website would be a great point of contact. It is www.bewellmindbodyspirit.com.
Thank you very much, Dr. Sujatha Reddy. And I'm Dr. Renee Mehrra. Thank you so much for watching. And be sure to like, subscribe, and share our videos. Thank you.
Thank you, Renee.